Hi guys, it's Janae with Daily Dental Hygiene, and today I'm going to be talking about the fastest, easiest way to utilize your notes and your time. Hello, notes can take up so much time, and I feel like personally, it just takes so long. I end up honestly just, missing out on so much information that I want to either put down or, OHI went over strictly because there's just not enough time to write all these notes. So I'm going to be talking about auto notes, templates, and different formats to make things go way smoother and way easier so you can put down all the information you did, have more detail, but also get to your next patient. So the first thing I want to talk about is different softwares like Dentrix, EagleSoft, SoftDent, OpenDent. All these different softwares have auto notes that you can use. These are notes that when you click on what you did, it pulls up an automatic template in the notes and you can just fill in what you've already done. For example, you can create a template for pro fees, perio maintenances, a new patient exam, stuff like that. Dentists, hygienist assistants all use these. One thing I want to add is that most of these softwares, you can even color coordinate. So for me, I put all my pro fees in pink. I put all my perio maintenances in blue and all my SRPs in purple. So when I pull up a patient's notes, there'll be hundreds of notes, but I can always see, oh, I see pink. That's my note. That's my personal color. I did a pro fee. Or, oh, purple. I saw in 2018 I had a purple note. I know that's SRPs. Now it's changed to blue. Now they're a perio maintenance. So it's just kind of easy to, when you're trying to fumble through all the notes to see what you wrote last, just to kind of color coordinate it. I recommend, especially if you have multiple hygienists in your office, that you guys all pick a color to make things very easy to see who did what and where and when. On top of it, use these auto notes. A lot of places want all the hygienists to use the same auto note. I don't really advocate for that. Every hygienist is different. What we do, what we recommend is completely different. And I recommend that you make your own auto note that is personal to you. What are the OHIs that you go over? What are your post-op instructions with your patients? So make an auto note that is specific to you. Now I want to talk about how to make these notes go by so much faster. Okay, this is a secret that I don't see in almost any chart, but I saw another hygienist doing this at my last practice and I thought, wow, this is really easy. So what you do is you just put X's next to everything you did. For example, the treatment will say treatment and it'll say dash exam, dash prophy, dash floss, dash polish. And you just put an X next to what you did on the chart. Just do an underscore and then write whatever it is. So for example, if I did SRPs, instead of having to write out Articaine, HCl with Epi, I have a pre-selected format that says lidocaine, Articaine, mepivacaine, and I simply just put an X next to whichever anesthesia I use that time. And then I will have a section for SRPs, upper right, lower right, lower left, all that. And I just put an X in the chart for what I did. It is so much faster than writing out upper right quad with mepivacaine, HCl, with the whole, all of that. Plus, it's easy to mess up. So it's kind of nice to have that option just to easily put X's next to everything. Now, and that's why I'm saying with the auto notes, you should have different auto notes. You should have a perio maintenance auto note, a prophy, and an SRP. So for the x-rays, I'll put a section that says like x-rays, FMX, checkup, PA, and I will just put an X next to whatever I did. If you are still using paper chart notes, you can even print out a pre-selected form. That's a lot easier than having to write everything down in those paper notes, which is honestly scribble-scrabbled and doesn't even look good. Just go on the computer and you can print out, perio maintenance papers, SRP, prophy, whatever. And if you even want, you could cut them out and glue it onto their chart. Or you could, get, they even sell paper that has like peel off. You could just cut it and stick it onto the chart so that it's easy, it's clean, it looks neat, and you're able to, write down what you properly did. I really like the X method because it just makes everything so much faster, so much easier, way cleaner, and you're not missing things. On top of it, I even, for me, my OHI is pretty much all the same. So And you don't have to do the X method. Like for example, your auto note, if you did a prophy, you could put in the treatment, like I put like TX, prophy, comma, polish, comma, exam, comma, OHI, comma, floss, comma, checkup x-rays, comma, full mouth probe. If that time I didn't probe, I'll just delete out the part that says full mouth probe, but I'll always put more in the treatment than what I personally did, and then I just easily delete. It's easy to delete stuff. It's harder to try to type it in. What I like about this method is if there's more stuff I want to add, at the end of my section, I'll have a notes section. And that's where I put things like, Janice has 3 kids. She works in real estate. She's going to the Bahamas this summer. Son just started in baseball. I'll put these personalized notes about my patients at the very end, but I think the X method and the auto note method is great. I'm just going to give you a quick rundown of what I put in my notes. So the first thing I always put at the very top is reviewed medical history. And I personally put no changes in medical history, no concerns or contraindications, period. Patient states that they have not had any hospitalizations or surgeries within the last year. The reason I put that is because patients with hip, joint, kidney, whatever, I want to cover my butt and make sure that I put that. Underneath that, I'll put treatment. I just put TX. That's where I do my treatment. Next section is oral hygiene, and then I'll put plaque, and then underneath it, I'll do light, medium, light, mod, heavy, and I just put an X next to what it was. Then calculus, light, medium, whatever. Stain, light, medium, whatever. Put an X, X, X. After oral hygiene, I go into oral hygiene instructions. You can write down your most common OHIs that you go over with patients. I do mod, bass, and flossing, and dental products personalized for them. X, X, X. After that, I do the note section, and that's where I tailor it to the specific patient. Patient's a gagger, patient drowns all the time, stuff like that. Under that section, I'll put, I always put patient left in good mood and condition, period. All post-op instructions were covered with patient. Then under that, I put NV for next visit, and then at the end, I do Janae, my last name, RDH, and my dental hygiene number, 131313. Always have that stuff in there. And that is the fastest way to utilize your notes. Save your sanity and save your time. So try auto notes, color coordinating, printing out stuff if you have paper charts, and customizing templates for yourself. Take care, guys.